I'm honored to be here to give a voice to my patients and who have been marginalized for years and years.
CDC walked into my office and said we failed in Lyme. I suggest within 30 days to have the CDC guidelines updated with co-infections that exist and with those symptoms that exist to be distributed to all hospitals and doctors. At least let them know to test, because they're oblivious to they're letting people out without proper diagnostics, what they get sicker and sicker from. People are running from doctor to doctor, different symptoms, and at the same time, they can't provide to their families, and it's out of pocket. Insurance should be addressed right away, and it should be even there should be executive order that they have to cover the extended care.
I realized my father was most likely suffering from undiagnosed Lyme for more than 20 years. So he had an insidiously progressive dilated cardiomyopathy. He was given 6 months to live. They were putting him on a heart transplant list. And I went to the cardiologist and I said, can we test him for Lyme? And the guy refused. And I was thrust in this very unfortunate position to try to have to desperately save my father's life.
My parents, who watched me sprint across soccer fields, now watched as I struggled to go on walks, to take deep breaths, and even just to function without pain and fatigue.
And I have been battling tick-borne diseases for 14 years now. It took 51 doctors and 18 months for me to just be diagnosed with Lyme disease. Then it took another 3 years and 4 more doctors to be diagnosed with 5 other co-infections.
When you mix medicine with politics, you know what you get? Politics. There's a quote as you walked into this building from Hubert Humphrey, and he says, the moral obligation of government to take care of those living in the shadows. And folks who suffer from chronic Lyme are indeed living in the shadows. As Congressman Smith said, when you're talking to the wall, nothing happens. After a while, you realize that it's not an accident. There's an active desire not to hear the story get loud. I can't even keep track of the number of relatives who have Lyme disease, much less my friends. And these people are not crazy. So we've updated the chronic care management category for Medicare, which are people whose chronic conditions, and they have to have at least 2, will expected to be lasting at least 12 months or until death. We don't want the latter. We want the former, so we're going to pay for it.
Lyme and COVID are the numbers 6 and 7, respectively, chronic diseases in this country after diabetes, obesity, cardiac disease. So the burden is enormous. And the economic costs have not been quantified anywhere, but as Dr. Oz said, there are all kinds of collateral costs when people can't work, when families are destroyed. And I've seen the pressure that it puts on families when you have a child who's chronically ill. I think my son has seen more than 51 doctors. And that's what happens. That is the story. That is the odyssey of American kids. I'd like each of you maybe to go around and talk about the most exciting innovations that you're seeing right now that might give hope to people, to patients who have Lyme disease around this country.
I think we're seeing an explosion in new diagnostics that are coming through. And as you mentioned, I think diagnostics are the start of all of this. Until we have a diagnostic that allows us to clearly separate out patients, many people think that Lyme disease is probably not just one disease. Until we have tests that separate people into the different subgroups of Lyme disease, we won't be able to really test the treatments that are appropriate and going to work on them. And when we lump people together and test a treatment, it's not going to work in some, it's going to work in some, but it washes out, so you can't tell if anything's working. Our group is working on narrow spectrum antibiotics that can be taken for long periods of time to prevent disease, but could also be used to try longer term therapy, because all of our tests for chronic Lyme disease have been done with pretty short-term antibiotics, like a couple of months. So if we had something safe that we could use for longer periods of time, we could really test these hypotheses and see if they work.
Today, diagnostics with Lyme disease, they take time. They take time, and tick-borne diseases, they do not have time. They are very time sensitive. And this can be completed within 20 minutes. In our hopes, you could buy it at a Walgreens store. And I believe that this is a rapid test for tick-borne diseases that could really help people all over the world, especially in rural areas where they might not have access to clinics. Additionally, LymeSeq is also working on a multiplex immunoassay, which has AI learning as well, and it has a 94% sensitivity rate, which means that it is extremely capable of detecting tick-borne diseases and Lyme disease. So I think that a lot of universities and a lot of groups are creating incredible diagnostic tools. And I think what we can do is really just fast track these innovations, because once we get a diagnostic tool that can accurately detect tick-borne diseases, Lyme disease included, then that allows a lot more capabilities for getting proper treatments, medications, insurance companies to cover these things.
Patients spend all their money in many years into treatments only to find at the end of the road that it didn't work, and you're out of money now.
We know that the pathogen persists, and yet we don't have a good direct detection test on the market. We can't even kill Lyme bacteria in the test tube with these several antibiotics that are recommended by the Infectious Disease Society of America as the purported curative treatments for Lyme. This is an easy to diagnose and easy to treat illness when the facts speak otherwise, and they have done so for decades. And when it comes to Bartonella, Bartonella is a beast. It's incredibly antimicrobial resistant. There's only one class of antibiotics that actively kills and effectively kills Bartonella, and that is aminoglycosides. And they are hamstrung by horrible pharmacokinetics. They don't get inside cells. Bartonella is an intracellular infection. They don't pass the blood-brain barrier. Bartonella does. They are horribly toxic. People can only be on them for a couple of weeks before developing, ear toxicity and kidney toxicity. A couple of people have said that Lyme can mimic this disease and mimic that disease and what have you. And when I opened the doors, one of the first things I noticed that people were coming in with diagnoses of fibromyalgia and rheumatoid arthritis and lupus and multiple sclerosis and ME/CFS, and patients were getting better from these various conditions. So if it mimics a condition 100%, and Lyme and these other infections are known to be able to mimic these other conditions, then by definition it's causing these conditions. This is a broader issue than people, I think, realize. This is not just about Lyme in the way that people think of as Lyme, but I think that these other conditions, like there are over a dozen studies, randomized controlled trials on rheumatoid arthritis showing that antibiotics work and placebo doesn't. The critics of these studies will say, well, some antibiotics have anti-inflammatory effects, that's why they work. No, they've also done the studies in antibiotics that are completely devoid of anti-inflammatory effects. There are multiple open label trials on multiple sclerosis showing that antibiotics help multiple sclerosis patients when standard MS therapies have failed. And I can tell you from my personal experience over 30 years, I've gotten quite a number of patients with these conditions to get better after standard therapies have failed.
We argue about 21 weeks of IV this or that, but if the patient's still sick afterwards, and you go to any of the Lyme events, you'll see a large number of patients who claim that they've been through every treatment possible: hyperthermia treatment, hyperbaric treatment. In surgery, there's an adage that if you have more than one operation to treat a disease, you don't have a good operation. Because if you had a perfect operation, you wouldn't need two.
The possibility of having better diagnostics and research, money going into research, that is going to help legitimize this, disease, this diagnosis. The aspect of that will impact me and therefore impact my patients is lifting the barriers to the clinicians. I think the biggest problem that I saw when I worked in internal medicine is I was given 15 minutes to talk to a patient, and that's not enough time to take care of anything, really. I started working with Lyme patients, and I was afforded the ability to spend an hour, if not longer, with these patients, and that is critical because this is a disease that affects every system of the body, and you have to systematically go through those systems to support the body so that it's in the best condition possible to treat. Have approaches from both Eastern and Western medication or medicine to help holistically treat the patient, which I think is incredibly important. The innovations that will occur, hopefully from this roundtable and future roundtables, will allow me to do my job that much better.
In the past, when our bill would come before that subcommittee, it was killed each and every year. The gentleman from my own state of New Jersey, Frank Pallone, he was chairman. I lobbied him, asked him, appealed to him, and he would not bring up the bill. We always had like a civil, okay, thank you, go on, have a nice day, from the top people at NIH, CDC, meeting, the 92 meeting, I should say, was unbelievable. They were the best of the best, top people. And they basically said, no, thank you. There's the door. Chronic Lyme does not exist.